Okay, so hello everyone, and welcome to the Iowa Intermediary Network Connection Lab. Today's presentation is Helping Hands, and we're going to be exploring the world of therapy service careers. Our panelists today are Jamie Butte, the director of the Respiratory Therapy Program at Hawkeye Community College, and Deb Eel, physical therapist and owner of Agape Therapy. First off, we're going to start out by having them each talk about their backgrounds and experience, as well as what brought them to the world of therapy services. Jamie, why don't you go ahead and start us off? Oh, Jamie, you're on mute.
How did I forget that? My name is Jamie Butte. I'm a registered respiratory therapist. I actually picked my career a long time ago, and it was randomly out of a book. I was reading something about asthma and how respiratory therapists take care of asthma patients. And I was like, well, that seems kind of cool. That seems really interesting. And I ended up going to school for it and ended up falling in love with it. And it's been my career ever since. So I came here to Hawkeye and actually graduated from the program and became a registered respiratory therapist. After graduation, I went to work at Unity Point here in Waterloo, where I worked for 9 years. And then I came out here to Hawkeye, where I've been ever since. So I've been a respiratory therapist for 23 years and have loved every minute of it. I've also added to my schooling. I've gone on to get my bachelor's degree, both in respiratory care and in psychology, and then went on to earn my master's degree in business. But there's also some cool certifications that you can get once you're a registered respiratory therapist. And I've become certified as an adult critical care specialist. And so that's been really kind of cool as well. So there's me in a nutshell.
Okay, thank you. And what about you, Deb?
Hi, I've been a physical therapist for 38 years. I graduated from the University of Iowa and have only worked in two places my entire career. When I was a student, I did an internship, which is kind of like student teaching at a rehabilitation hospital. That is where people with a major injury, like a head injury or a spinal cord injury, go. I would mostly help people become independent and try to walk again. I liked it so much, I thought I'd do that my whole career. But while I was there, I met another therapist and we got married. Then we decided to start our own physical therapy company. We've been doing that for 35 years now. And 7 years ago, our daughter joined us as a physical therapist. We have 26 employees, and most importantly, I still love what I do.
Thank you, Deb. And Jamie, thank you for joining us today. We have a couple of questions here, given your therapy services careers. And one of the first questions we have for you today is, what is a common injury or illness you encounter with patients, and what is a treatment commonly used? Jamie, if you could take that first.
Certainly. Actually, respiratory therapists, not a lot of people know what we do. And that's why we're kind of one of those unheard of careers. Not until you have to use us. And that's really where we get a lot of students who start the program. So the most commonly thing that we're known for is asthma and emphysema. So people with trouble breathing, but this could also be in every age range. So we also deal with newborn babies who have trouble breathing. And so we might need to put these little prongs in their nose and kind of help open up their airways, called CPAP, or maybe even put them on the ventilator. For pediatric patients, like maybe the ages of some of your younger brothers and sisters, RSV is really big, or even like a pneumonia, and we could give breathing treatments to them. In the adult world, though, we also deal with bronchitis, we deal with sleep apnea, or even tracheostomy tubes. And some of the therapies for that, we could put them on the ventilator, but we're most commonly known for our nebulizers or breathing treatments. And then in addition to that, our inhalers. And there are a ton of inhalers. And you're going to get this sheet when you're done at the end, you're going to get this document. But look at all of the inhalers we have out right now. And there are a ton more coming out every day. And in order to get better, patients need to take these inhalers as prescribed Otherwise, it does them no good. They don't get the medication that they're supposed to get. So some of our therapies is to educate our patient on how to take them. So I have a few examples in front of me, and this is a good time for like a little quiz, so you might want to pay attention. I'm going to move my screen just a little bit and show you some of the inhalers I have on hand. Look at all of these, and they all look very different. And a lot of times our patients don't know what medications they're taking, and so they just tell us colors. Oh, I take the purple one, or oh, I take this green one. So real quick, I'm going to talk about the different kinds. There's two types of inhalers. Ones that you will actually press a button as you're breathing in. Those are inhalers that you use more for when you're having trouble breathing. So they're called rescue inhalers, because some of the other ones you have to actually suck in hard and fast. And those inhalers, if you're having trouble breathing, you're not going to be able to suck up that medication. So once again, our rescue ones are ones that you'll have an inhaler that you'll actually have to hit a button as you're breathing in. And those typically, they want you to do a slow, deep breath. That's the best way to get the medicine. The other ones that are dry powder inhalers, those you have to breathe in really hard and fast. It doesn't matter when, you can actuate it and wait a while. But those are more for maintenance, because if you are trying to take that when you're really short of breath, you're not going to get the medication. Maintenance drugs are really important that we educate our patients to take all the time, because that's what its purpose is. Maintenance keeps you from having those episodes of shortness of breath and keeps you from going to the doctor or maybe even the hospital. Rescue ones are when you are having those episodes, having trouble breathing, you would use those inhalers. So here's a little quiz. I have this fun inhaler for you. And what you do is you open it up, and it actually has this little pill that you put in, close the lid, and then you'll crunch it. And anytime you're ready, you're going to put this in your mouth and take a fast, hard breath in. And you're done. So what do you think? Do you think this one's a metered dose inhaler, also known as an MDI? Or do you think it's a dry powder inhaler? And then do you think it's a maintenance drug, or do you think it's a rescue drug? And she has your little poll up. I like it. Look at all those answers. This is actually a dry powder inhaler because of you crunch it, and then you can take as long as you want, and then you take that hard, fast, deep breath in. That's what makes it a maintenance drug. So this one's a dry powder inhaler and maintenance. Okay, you get another opportunity. Your second one. How you instruct your patient is you open the lid, twist it, and it has a button. You're going to put this in your mouth, and as you start inhaling, you're going to hit this button and take a slow, deep breath in. So what do you think? Is it a metered dose inhaler? Or is it a dry powder inhaler? And then do you think you'd use it for rescue or for maintenance? Look at you guys, very smart. Yep, that one's a metered dose inhaler, and it's a rescue medication. So you would use that one if you're having trouble breathing. You would use that right away versus some of the other ones. Okay, your third opportunity. Shake it up. You would tell your patient to, once again, put this in your mouth and press down on this as you're taking that slow, deep breath in. And then you let it out. So what do you think? Is this a metered dose inhaler, a dry powder inhaler? And then is it maintenance or rescue? Great, everybody knew it was a metered dose inhaler. This one is actually also for rescue. Your dry powder inhalers are always for maintenance. Some of your metered dose inhalers could be for rescue or maintenance. And this one happens to be Atrovent because of the green color, and it's for rescue. Okay, last one, and this one's the most fun one. I don't know. It's a big purple circle, and I always love it when patients tell me they take the big purple circle for the inhaler. So it's super easy. You just open the lid, which will expose the mouthpiece. Open the medication, have them put it in their mouth whenever they're ready, and take a hard, fast breath in. Then you close it. What do you think? Metered dose inhaler, dry powder inhaler, and then is it maintenance or rescue? Okay, because of that actuation and they're not actuating it as they're breathing in, that's what makes it a dry powder inhaler. And all dry powder inhalers are for maintenance, because once again, you have to take that hard, fast breath in. You can't do that when you're short of breath. And so it can't be a rescue drug. And then, like I said, there are so many other inhalers out. Your meter dose inhalers could be rescue or long-term maintenance. That was your first little chance at being a respiratory therapist. You guys did really well.
Thank you so much, Jamie. Deb, on to you, that same question. What is a common injury or illness you encounter with patients, and what is a treatment commonly used?
Physical therapy is really broad. We're actually movement experts is what we're called. We're movement experts who try to improve the quality of life through prescribed exercises. Instead of a dosage like Jamie gives, we tell people what they need to do physically to move around. We do hands-on care and we do patient education. Physical therapists diagnose and treat individuals of all ages, from newborns to people at the end of their life. Many patients have injuries or disabilities or other health conditions that need treatment. But therapists also care for people who simply want to become healthier and try to prevent future problems. Physical therapists examine every person on their own because they each have a different problem, and then develop a treatment plan to improve their ability to move or reduce or manage their pain, or restore their function, or prevent a disability. PTs can have a profound effect on people's lives. They help people achieve fitness goals or regain or maintain their independence and lead active lives. Let me grab a piece of equipment to show you one type of equipment that we use. There we go. How's that look? Does this look like physical therapy? I'm going to play a short video clip for you and you'll see what I'm seeing. Okay, it looks like she's just having fun, but we use this in therapy for balance, coordination, motor control, or endurance, or even reducing falls. Most of our work is done with our hands, and tasks or exercises we give the patient to practice at home and to help them improve their function. Physical therapists practice in a wide variety of settings, including hospitals, outpatient clinics, which is what we're doing, people's homes. We also do things in people's homes when they can't get to us, schools, sports and fitness facilities, workplaces, and also nursing homes.
Great, thanks for sharing all of that information.
Mm-hmm.
Additional question, and I apologize if I missed it when you were giving your brief introduction, but how many years of study are required for your positions? And Deb, you can feel free to go ahead and answer.
Okay. Normally a student needs to earn their bachelor's degree, which is a 4-year degree from any college you want to go to. Some people play sports in college, they can do that, or sing in the choir, get a regular 4-year degree. Then you apply to graduate school, and it takes 3 more years to get a doctorate in physical therapy. You can also become a physical therapy assistant. The assistants do most of the same treatments, but they don't do the initial evaluations for people. This is a 2-year program, so it can either take 2 years all the way up to 7 years.
Thanks, Deb. And Jamie, how about yours?
The respiratory therapy program here at Hawkeye is a 2-year degree, and most degrees are 2 years. One of the cool things that's different about Hawkeye, and it's especially pertinent to our high school students, is that if you do the concurrent enrollment, you can get the first year of our program done while you're still in high school. And then once you come to Hawkeye, our program is actually 14 months. We start officially every June, and then you take all respiratory classes and you're done in July. So officially 2 years, but then what's great is you can move on to get a bachelor's degree, but a lot of students like to get a job and then go back for more education, because typically there's employer reimbursement to help you pay for it. And then in addition to that, you can go on to earn other certifications if you want to specialize in an area. So if you really want to specialize in the neonatal or pediatric world, you can study, and this could be online courses and sit for your exam. You can study to be an asthma educator. So that would be sitting with patients and teaching them about medications and how to stay lung healthy. You can earn certification as a sleep study specialist. And then you can also move on to like a smoking cessation specialist or somebody who rehabs patients with lung disorders. There's a lot of extra certifications you can get. You don't have to go on for extra schooling. You might have to brush up on a little bit of coursework, but there's so many areas you can move on to.
Thank you. Jamie, while you're still unmuted, how has your therapy field changed since you first entered in the career path?
What I love about my profession is that there's always something new coming out. And it's, obviously the disorders don't change. Asthma will always be asthma, but there's always a different treatment plan coming up. Like there's new medications out on the market. We just learn more and more about these disorders. One of the newest things are high flow nasal cannulas. I don't know if anyone has heard about it, but especially with COVID, we have seen a lot more of these high flow nasal cannulas put on patients before we have to go to that step of putting them on the ventilator. So there's always kind of new things coming out, which is really great, always to improve our care. And that's it.
Deb, how about you? How has your therapy field changed since you first entered in the career path?
Probably about the biggest change legislatively was about 5 years after I graduated. A bill was signed by the governor that allowed therapists to see their patients without having to go to a doctor first. Before that, people had to go to a doctor before being allowed to see a therapist. There are many things a therapist does for the patient that don't require them to see the doctor first. So this saved the patient a lot of money by not having to go to 2 different professionals for one problem. So now people can just come in and walk off the street. If they have a sprained ankle or something like that, that's simple, that they don't need to see a doctor for, then we can just treat them right away. So that helped us a lot to have direct access to the patients.
Okay, Deb, while you're unmuted, I got another question for you. What personality traits and skills are important for success in your therapy field?
Have you ever heard of the word empathy? Do you know what that means? Other words similar in meaning are understanding, compassion, and rapport. A therapist cares for others. It is a common character trait for any healthcare professional. It is a challenging and very rewarding job to figure out your patient's problem, plan a way to help them improve, like watching them walk again, or to run, or lift, or be pain-free for the first time in a long time. You can work in any of the settings we've talked about and see any of the hundreds of diagnoses and diseases that we see. But unless you have empathy for your patients, you will not be a successful therapist. So if this is a character trait for you, be sure to look at the website called choosept.com. It can give you a lot of information on physical therapy. That's choosept.com.
Thanks, Deb. Jamie, what about you? What personality traits and skills are important for success in your therapy field?
I really like what Deb said, and that's especially, like she said, true in all healthcare professions. But especially in ours, a lot of our students go on to work in the acute care hospital. So that would be like your Unity Point here or Mercy One. And we see our patients at their worst. And they're not feeling good, they're not breathing very well. So they're panicking. You know, if any one of us had trouble breathing, we'd probably be panicking. And so we have to really be able to have patience with our patients, and like she said, provide empathy for them, do what we can, talk them through it. And there's a bunch of different areas respiratory therapists can go to, but it's always an evolving career. So you always have to be willing to study and learn more. You have to be that continual learner, because if you just keep what you learned when you graduated, you're behind, because things are changing every day. And so you have to be able to keep up with it. So those are kind of the two biggest skills that you will need.
Great, thanks so much. And this goes out to both of you. What can students in high school do now, as far as maybe start to prepare for, helping therapy careers, whether it's physical therapy or whether it's respiratory therapy? What are some things that, or advice you would give high school students at this point? And anyone can answer.
Go ahead, then.
A lot of times the best thing to do is observe what's happening. If you know of someone that's maybe they tore their ACL or sprained their ankle or something like that, you could go with them to their physical therapy appointment and see actually what happens there. We'll be opening up soon again after COVID for volunteers and people who observe, which a lot of times it's kind of starts your freshman year of college, but you can observe, you can become an aide at a physical therapy office. There's a lot of places that will take you, allow you to observe and see if it's a career that you really want to do or not. We've had people that have come and watched and they didn't like it. And some became pharmacists or did other jobs to other healthcare careers because they didn't like what they saw. Whereas others, as soon as they saw it, they knew that's exactly what they wanted to do the rest of their lives. So that helps you know kind of if you're interested in a certain career or not.
And I agree with her. Some of the other things, like I said, take some of those concurrent enrollment high school classes. It will just save you in the long run to get some of those general education courses done and out of the way. But then also a suggestion is to maybe become a CNA, a certified nursing assistant or a nurse aide. They just, not that you need those skills, but if you come into the program with your CNA, you have a little bit more skill of walking into patients' rooms and communicating with your patients, and you're just a little bit more at ease dealing with your patients. And I see it, someone with the CNA background and someone not, they're so uncomfortable for a while that CNA really kind of gets you excited about working with people immediately. And kind of piggybacking off what Deb said, just know that this is something that you love to do, because if you don't love it, eventually you're going to move away from it. And so know what you're getting into, use all of your resources. Like she said, see if you can job shadow, ask around, see if you can find a therapist in the area where you can ask questions to, contact, program directors or anything, see if you can talk to current students. But I do see a huge, connect with, if you love it, you'll stay in it. But if you come in because you're kind of forced to, like, if you don't really love it, that's when students drop out or they graduate and then they go on for more schooling to do something else.
Thank you. We have here about 5 minutes left for today. And Deb, I think you might have some additional things that you can kind of show us. Would you mind giving us some examples here in terms of your career pathway in your field in physical therapy and how you assist patients or clients, if you will?
Sure. Sure. What I'll show you initially is actually, I'd like everyone to stand up out of their chair if possible. And if you're in a room with other students, I want you to kind of observe each other as you do this. And if you're alone, when we're done, check your parents tonight. I'm going to have you do an assessment on your parents, and you can see if you can pick out problem areas on them. So if someone hurts their knee or hip, you don't always know that that's the problem. Sometimes people have a sore back, or sometimes people have a sore knee, and that will cause them to have back pain. And we can be looking and see what the back problem is, but maybe the problem is actually their knee. So we do an initial screening a lot of times. So let me show you an example of that. So what I want you to do is I want you to take both arms and raise them all the way up over your head, straight arms all the way up, okay? And then once you're there, I want you to keep your feet completely on the floor. Don't let your heels come up, but slowly bend your knees as far as you can, and just keep going down. And as you go down, what we look for is maybe someone has a bad shoulder and they can't keep their arm up very long. And so one of their arms starts to kind of drop down a little bit. They don't have endurance or strength, a problem with their shoulders. That just gives us a quick screen. Some people maybe start to bend their knees and then they just bend forward like this instead of bending their knees. And it might be too painful to bend their knee to be able to go all the way down. Some people might bend their knees, but they keep their back real straight, because if they lean forward with their back, they've got a back injury. Or some people start to bend their knees and their heels come off the floor. If you have really tight calves, really tight heel cords, if you bend your knees, there's no way some people can keep their heels on the floor. So I want you to just do that quick screen. Look around at each other or watch your parents tonight. Arms up, slowly bend your knees, keep your heels on the floor, and see how low you can go, okay? Try that one tonight. I do have one other one. Put an object, a pencil or a pen or a mouse, something on your chair beside you, okay? That's down about, it's the height of your knees. Now, what I want you to do is pin your elbows against your body, and you have to keep your arms in tight, and you walk over to your chair and you bend down, keep bending your knees, keep your elbows pinned in until you can pick that object up off of your chair. And you'll notice you bend your legs a lot in order to reach down to the chair. Usually we just bend over at the waist and pick up, but that's not a very safe way to pick things up. So if you're going to pick something up off the floor, you should always bend your knees first, bend your knees and your hips, and then pick it up off the floor rather than just leaning over. Because again, when your arms are pinned to your side, that kind of helps you see, oh yeah, I really need to use my legs more when I pick something up. That'll help to avoid a back injury or something else happening. So those are two of the ways that we kind of check people real quickly to see if they have a problem. So check each other out. You can stop jabbering and talking with each other now, because I'm sure they want to bring it back in.
Thanks, Deb, for those tips. That's something I'm going to have to remember myself, is bend with my knees. All right, we just have a couple of minutes left. Just kind of one final thing. Any other suggestion or advice that you might have for high school students and or other participants here today in either your physical therapy careers, maybe professionally, or even as employability? Any other advice or suggestions you would have for today?
I would say for sure, stay healthy yourselves. If you don't stay strong, if you don't eat well, get your rest, it's pretty hard to help other people and to pour yourself into other people. So really prioritize your own health so that you can stay healthy and you can help other people regain health.
And I'll just say it again, find something that you love. As Deb said, I don't ever get offended if somebody does a job shadow and they come talk to me and they realize this is not for them. That is absolutely fine, because not every profession is for everyone. Just find something that you can connect with and that you can be passionate about. Because if you're not passionate about it, you're not going to stay in it. So do your research and figure out all of the health careers that are out there.
Thank you so much for your information and your knowledge and expertise and sharing with us today, Jamie and Deb. We really appreciate it. We wish everybody the best. Thank you for joining in today. And if for some reason you were unable to join live, a recording will be sent to you via email along with Jamie's inhaler handouts. Thank you so much and have a great day.
Thanks, everybody.
Bye.